The Clean Hospital Saves Lives, the Rising Profile of Environmental Cleaning. And just before we kickstart today, I would just like to share with you some housekeeping rules so that at least we can be able to have a smooth and informative and interactive session. I'd like to kindly ask if I could switch off my video for now, as I have an unstable internet. Thank you. So we would like to invite you to post your questions on the Q&A box so that they will be attended to either through the text or through the live response during the Q&A session. And for any other comments, we invite you to make use of the chat box. And then for our presenters, would like that if you could leave your video on during the time that you are presenting, or if it is not possible, you can, because of the internet challenges, you can then get to switch it off. And for those that won't be speaking at that particular moment, may you kindly put your microphone on mute and switch off your video so as to preserve the bandwidth. We have Arabic and Portuguese interpretation. So if you want to go to this translation, please go to the bottom of your screen, and then you can click on the icon and select the language that you want. For quality and educational purposes, we are recording this training session, and by participating, you're in the community of practice for those that haven't yet done so, as this is a forum whereby we get to also interact during the course of the other days. And then I'll also like to remind the participants that you will receive the slides and the recordings of this session at the end of the webinar within the first 24 to 48 hours. And alternatively, you can go through the ICANN website and also the AfricaCDC website so that you can access these recordings. And then since this is the end of the series, this is our final and 6th week for this series 13. We are going to be issuing the certificates at the end. And for those that are going to receive the certificates for participating, you should have attended at least 4 out of the 6 sessions, and you should have stayed on for at least an hour. And thank you so much. And before we can then get to move on to the business of the day. First and foremost, according to our program for today, we are going to have our EPI update just to have an idea and get to see what is happening across Africa with in relations to COVID-19 and monkeypox. And at this time, I would like to invite Dr. Amadou from CDC, AfricaCDC, who is an epidemiologist, to give us the EPI update. Over to you, Dr. Amadou. Thank you.
Thank you, Lizzie. Good morning or good afternoon, panelists and participants, depending on your location. Please, can you share the slide, please? Today, I will give you the update on the COVID-19 epidemiological situation in Africa. Okay, yes, thank you. To beginning with the global situation, we will take a look at the weekly number of new COVID-19 cases reported by 6 WHO regions, as indicated on the chart on the left side of this slide. This past week, more than 5.3 million new cases were reported globally, which is an 19% decrease when compared to the previous week. The majority of these new cases were reported from Western Pacific and the America region. As of yesterday, cumulatively, over 588 million cases and 6.4 million deaths have been reported, with case fatality rate 1.1%. Globally, 61% of eligible population has been fully vaccinated. Next slide, please. The map on the left shows the distribution of new cases reported across the 55 African Union member states during AP week. The 3 member states, Morocco and Tunisia, accounted for majority of the new cases reported during this week. Reported about 1,000 cases each, as shown in the dark brown color. The chart on this right side shows the number of new cases being reported by AP week. The number of new cases reported on the continent has declined for the past 4 weeks. The past 5 weeks are consecutive. However, we are not sure if this shows the true picture, as close to half of member states did not share testing data for the last few weeks. As of 6 p.m. yesterday, cumulatively, more than 11.8 million cases have been reported, with more than 256,000 deaths, resulting in a safer 2.2%. On the continent, only 21% of eligible persons has been fully vaccinated. Next slide, please. The chart on this slide is showing the number of new COVID-19 cases, Y-axis reported by week, X-axis for the past 4 weeks. It allows us to take a closer look at the trend of the new cases reported each week over the past month for the continent. On average, the number of new COVID-19 cases being reported each week over the past 4 weeks decreased by 33% each week. Next slide, please. This slide shows the trend of new cases reported over the past month across the 5 AU regions. Each panel on this slide is showing the number of new COVID-19 cases, Y-axis, reported over the past 4 weeks, X-axis in each region. The absolute number of cases reported each week is indicated for the context. The red and black lines show the trend in the percentage change of new COVID-19 cases by week. By region, over the past 4 weeks, there has been an average of 3% increase in the central region, 24% increase in the eastern region, 48% decrease in the northern region, 15% decrease in the southern region, and 2% decrease in the western region. Next slide, please. This slide is showing the distribution of COVID-19 cases reported per 1 million population per day across the continent in the past AP week. 35 countries reported less than 5 new cases per million per population per day. 6 member states reported between 5 to 19 new cases per 1 million per population per day. 1 member state, Seychelles, reported above 19 new cases per million population per day. This week, we do not have information for 13 member states. Next slide, please. This chart is showing the number of new cases of new COVID-19 deaths, Y-axis reported by week, X-axis for the past 4 weeks. The red line shows the trend in the percentage change of new COVID-19 deaths by week in Africa. Over the past 4 weeks, there has been an average of 35% decrease in of new deaths being reported each week for the continent. Next slide, please. The chart on each panel on this slide are showing the number of new COVID-19 deaths, Y-axis reported over the past 4 weeks, X-axis in the 5 regions. The absolute number of deaths reported each week is indicated for context. The red and black lines show the trend in the percentage change of new COVID-19 death by week. By region, over the past 4 weeks, there has been an average 4% decrease in the northern, 3% decrease in the eastern, 35% decrease in the northern, 30% decrease in the southern, and 20% increase in the western region. Next slide, please. This slide is showing the COVID-19 case fatality rate by AU member states classified into 4 categories. 41 member states are reporting a higher safer than the global safer, which is now 1.1%. 11 countries have a safer that is less than 1%, and 2 member states have a case fatality rate that is greater than 5%. There are Somalia and Sudan. Next slide, please. Next slide, please. Okay, thank you. This slide showed a summary of the COVID-19 testing on the continent. Cumulatively, over 121.1 million tests have been conducted, which with a test per case ratio of 10.2 and positivity rate of 9.8%. In the past weeks, more than 691,000 new tests were conducted, which is a 25% increase in the number of tests conducted in week 32 compared to the previous week. The positivity rate in the past AP week was 1.5, which is a 48% decrease compared to the previous week. Next slide, please. Looking at the test positivity by AU member states in the past epidemiological week, 16 member states are at the test positivity that is less than 3%, while 2 countries, Cote d'Ivoire and Ghana, are the test positivity that is between 5 to less than 12%, while one country, Libya, has a test positivity that is great than 12%. We observe an increase in the positivity rate for 2 member states compared to the previous. We do not have received lab information for 31 countries this week. Next slide, please. Thank you for your attention. Over to you, Lindsay.
Thank you so much, Dr. Amadou, for giving us the update of what is happening across the continent. And as we can note that there is indeed a decrease or a decline in the number of cases, but the take-home message is for us to keep on promoting good IPC practices and getting to remind the healthcare workers and the community that it's not yet over and we still need to up our game in terms of infection prevention and control. So our next speaker is Professor Didier Pitot. And Professor Pitot, we are very privileged to have you in this webinar. Professor Pitot is a hospital epidemiologist and the director of the Infection Control Program and World Health Organization Collaborating Center of Infection Prevention and Control and Antimicrobial Resistance in the University of Geneva Hospitals and the Faculty of Medicine. He holds an honorary professorship at the Imperial College of London and also the Hong Kong Polytechnic University School of Health Science. Prof. Pitot has authored and co-authored more than 500 publications in scientific journals and as the editor of the first textbook on hand hygiene, a handbook for medical professionals. And I usually, when I talk about him, I refer to him as the modern day father of hand hygiene. Prof. Pitet is also an editorial consultant for The Lancet on the books of Clean Hands, Save Life editions. She has written also, he's also a French writer and has had a documentary film on clean hands. Prof. Pitet is a recipient of several national and international honors, including a Commander of the British Empire, which has been awarded by Her Majesty Queen Elizabeth II for the services to the prevention of healthcare-associated infection in the UK, and also in the Society of Healthcare Epidemiology of America lectureship, and the European Society of Clinical Microbiology and Infectious Diseases, and was given an award of excellence in 2009. In 2009. Since 2005, Professor Pitet has been working closely with the WHO as the lead advisor of the first Global Patient Safety Challenge, whose Clean Care is Safe Care program is active in hospitals in 189 of the 195 United Nations member states. Prof. Pitet conducts numerous research projects, in particular concerning epidemiology, prevention and control of infections, and the development of innovative strategies to improve hand hygiene compliance and the quality of patient care so that they promote safety. He is also involved in numerous humanitarian projects and has also credited and revolutionized patient care process in hospitals by replacing hand washing with soap and water with the systematic use of the alcohol-based hand rubs and spreading this change in practice to healthcare centers